As a practicing lung doctor for almost 10 years, I've seen thousands of people with lung cancer, and it's true that most cases are associated with smoking, but not all of them. There are actually different kinds of lung cancer, and one in particular is a type that even non-smokers can get, and that's something called lung adenocarcinoma, starting with warning sign number 10, persistent cough. A cough associated with a cold or a respiratory infection subsides in a week or two. However, persistent cough that doesn't go away could be a symptom of lung cancer. Pay attention to whether your chronic cough is constant or intermittent, if it's dry or if it's producing mucus, or if it has changed in any way. Also, if you're coughing up blood, that's a big one because even if you're coughing up blood in small amounts, that can be a sign of lung cancer, and that would warrant immediate medical attention. Warning sign number 9 would be shortness of breath. Many illnesses can present with shortness of breath, which is a red flag symptom that requires medical attention. Experiencing shortness of breath or becoming easily winded could also be a potential warning sign of lung cancer, especially if that tumor is blocking an airway. So if it's causing a narrowing of the airway, that's something that could be causing shortness of breath. Or if that tumor is actually causing fluid to build up outside around the lung, known as a pleural effusion, that could do it as well. Chest pain. Lung cancer can cause chest pain, especially if it metastasizes to the chest wall or if it causes swollen lymph nodes within the chest. The pain, that can feel sharp or could feel like a constant pain. It could be a dull pain or could come and go, meaning it's intermittent. So chest pain that worsens with deep breathing or coughing or even laughing or sneezing, that could be a sign of lung cancer. Warning sign number 7, wheezing. So when air passages of the lungs become either blocked or constricted or inflamed, you could experience wheezing or a whistling type of sound when you breathe, specifically on the exhale. So while wheezing can be associated with numerous conditions such as asthma or COPD, it could also be a sign of lung cancer. Recurring chest infections. Recurring chest infections like bronchitis or pneumonia can be a sign of lung cancer. So while healthy people, they can suffer from these conditions, a recurring pattern might indicate an underlying issue like a lung tumor that's blocking the airway and therefore predisposing you to infections. Lung cancer can also contribute to fatigue, particularly if that cancer is advanced. So fatigue linked to cancers is usually more intense compared to the typical run-of-the-mill feeling tired, and in that case, with cancer fatigue, it does not improve with rest. If someone has a hoarse voice that doesn't go away or a significant change in their voice, that could be a sign of lung cancer. And this can actually result from a tumor that presses on a nerve that controls the larynx or the voice box, called the recurrent laryngeal nerve. Lung cancer can sometimes cause difficulty swallowing, often accompanied by pain. This happens if a tumor is pressing on the esophagus, which is the muscular tube that connects from the throat down to the stomach. Or if that cancer has spread to the lymph nodes and those swollen lymph nodes then end up pressing up against the esophagus. Most cancers decrease appetite and therefore have an unexplained weight loss in that person of 10 pounds or more, which could be the first sign of cancer. And lung cancer is no exception. Okay, warning sign number 1, it's an interesting one that most people don't think about or even know about, and that's changes in the fingernails. So lung cancer can cause clubbing of the fingernails, which is enlargement and or rounding of the fingertips. Certainly not the only thing that can cause clubbing of the fingernails, but if you notice this change, it's definitely something that needs to be looked at, and it could be a potential sign of lung cancer.